going to do is I'm going to place this on the side of her pelvis, kind of where there's often a seam. And she actually looks pretty good. So you see her weight, if I were to draw a line from the side of her hips, it comes all the way down to this little bony knob here called your lateral malleolus. And so we want this nice line so that our glutes can be available to support us. Let's see what often happens, especially with pregnancy, is our body tends to come forward. See now her hips, if I were to take this plumb line and go even more forward, like exaggerate it. Yeah, you see now the pelvis is in front of the body. You see her toes are starting to grip. There's way more pressure forward on this front wall. It probably doesn't feel good, right?
No.
And so now her glutes aren't having to really do a lot of work. I like to call our glutes besties with our pelvic floor. They're also what stabilizes the pelvis. And so this is not a functional place. And if you think about gravity, which is on us constantly, the pressure here, where are you feeling it? Maybe like back? Yeah, so this is not a great supportive place to be. And so a better place to be is having those hips back over the ankles. So now we're stacked, and if I were to come down as gravity, now she's really secure here. Her pelvis is better able to support itself. This is one of the most common compensations I see in pregnancy, and you're going to do what's called an anterior tilt. So now the ASIS are coming in front of the pubic symphysis. And another thing that's happening here, take one hand to your pubic bone and one hand to your ribs, and then do it. What's happening to the core? It's having to lengthen. This core is already needing to stretch a lot to accommodate the pregnancy, and so this is not great. It's also really hard to generate force in the core in this position. Our core likes to live in a place between neutral ribs and neutral pelvis. So the pelvis is really going to work best in this neutral position.
Here's a common but not ideal posture of pregnancy. When we shift the hips forward of the ankles, we put a lot of added pressure on the core, which is already separating. So we want to support optimal alignment so that we can minimize excessive separation. We also want to make those glutes available. Our glutes are besties with our pelvic floor. So if those glutes are tight, then the pelvic floor is tight, and this is not ideal for birth. So we work on length and strength of those tissues, and we also work on a release of those tissues through this shaking motion, which you can do with a partner. When the glutes are supple, this allows for suppleness in the pelvic floor, which allows for the baby to rotate and yield through the pelvic floor for your most efficient birth possible. Follow for more tips for having an easier birth and a more functional pregnancy.